association with that. And now, two key statistics I think are relevant for certain context, for this particular conversation. One is that if you look across the continent today, the production of pharmaceutical products, Africa accounts for just about 0.7% globally. Now that's scary. Outside of that, we equally are informed by the data as well that the industry for pharmaceuticals, that is, in Africa has been growing in the last couple of years at about 10%. So clearly, there's some opportunity there that can be explored from an industrial perspective. But what are these opportunities? What do they look like? What sort of institutional architecture do we require to make that happen? And I am joined by individuals from different backgrounds, but who all work within the pharmaceutical industry. To my immediate left, you have Kautar. Please, when I introduce her, you show some appreciation at least. So let's put a round of applause for her. Yeah. Now, Kautar is a biotech executive and serves, at a very high level of corporate pharmaceutical industry in Africa. Next to her, we have Abimbola Adebaking, who's the Chief Executive Officer of Health Africa. Please, a round of applause for her for making time to join this conversation. And then to her left, we have Mariam Bigdeli, who is the World Health Organization representative here in the Kingdom of Morocco. Please put your hands together for her. What for me is interesting and exciting about this panel is that they're all female. And so I think we get to bring some human parts. I don't have anything against my fellow gender, but I think that conversations like this, when we have women in the room, a lot of the time we tend to move the conversation and explore from different perspectives. So I'm very excited about this and I'm looking forward to it. We shall spend about 30, 40 minutes going through a series of questions, and then we shall open up to you, the audience, to ask any questions that you may have. And I suspect that they will be more than ready to take these questions. I'll start off with you, Kautar. So we've talked about a potential gap in terms of manufacturing of pharmaceuticals in Africa. We've equally seen the existence of an opportunity, right? The industry has been growing at a certain trend. As an executive who works in the industry, perhaps you can frame the current attractiveness, if you like, of what the pharmaceutical industry looks like in Africa and what we can potentially do, if any, to further explore and expand that so we can expand the development of the industry.
Yeah, thank you very much for the question. I think from an investor perspective, the attractiveness of any investment, the investor will look at the size of the opportunity or the size of the market. He will look at the demand, the high demand, ideally. Then he will look at the capacity of a country or multiple countries to deliver in terms of quality of products. An investor in pharmaceutical industry will look into the pricing strategies that are implemented as well, because it gives him or her the margins. And last but not least, he would look into the practicalities of exporting the excess of productions elsewhere. So, for example, he will look at the regulations, whether they are harmonized across countries. He will look at the pooling of procurements to ensure the high demand that I spoke about. They will look at the free trade agreements, the tariffs across countries for the custom clearance. They will also, I believe, look into the capacity of distribution, so the supply chains, and whether these supply chains are fast or digitalized, ideally, because this is the benchmark in China, for example. I think those are the elements from an investor perspective. So if I go back to the first one that I mentioned, which is the size of the market, the African pharmaceutical market overall is valued at around $53 billion. It's peanuts when you compare it to the US market or the Japanese market. But it's a big market. Sub-Saharan Africa only, if we exclude all the North African region, Sub-Saharan Africa market is valued at around 14 billion. As a benchmark, India is valued at 16 billion. India, a country. Us, Sub-Saharan Africa, 46 countries, I believe, in Sub-Saharan Africa, is exactly the same
That's just
value
a cash flow of one company.
So I am not undervaluing the African market. I'm just saying that there is a potential, there is an opportunity, but there are a lot of things to do. So we are not completely ready, at least not all. Let me frame it this way, in a positive way, because this is what I think. Not all the countries are ready for local manufacturing, but others are.
Right.
So why don't we capitalize on those countries that are ready, that have done some work or that are a little bit more advanced, for them to manufacture and distribute to the other countries. I'm thinking, for example, about Egypt, North Africa. I'm thinking about South Africa for the South. The African pharmaceutical market is clustered, right? Most of the manufacturing facilities are in North Africa. I'm including Egypt with North Africa, of course. The operations in North Africa are small, meaning that the manufacturing facilities are not running at full speed. They have a low capacity, it was mentioned by Miriam, and a low utilization. We can fix that. But first, let's diagnose what's the problem. From a regulatory perspective, again, Miriam has mentioned the regulatory framework and the harmonization initiative that has been done very recently, 2021. It has been done only for vaccines. It hasn't been done for all the medicines. What does it mean? It means that we cannot, even if we think as a hub and as a region and there is the coordination, etc., as of today, maybe tomorrow things will change, but as of today, we cannot put forward a single registration for a new medicine across 4 countries at once. We just cannot. So, I mentioned low capacity and utilization. I mentioned the regulatory framework in terms of harmonization. But there is also another thing, because if our manufacturing facilities are not pre-qualified by the label of the WHO to produce for us, but also for exportation. Why exportation is important? Because it has a direct impact on our balance of trade, currency, right? We need dollars, we need euros. So export is, if we think strategically and politically about why should we manufacture locally, the first thing to think about after serving our populations and healthcare is the trade. We need to have a balance of trade that is positive